Good afternoon. Good afternoon and thank you. Happy Saturday. Hope you're having a good weekend. Thank you for tuning in today again at 1 o'clock. I'd encourage you to try to watch this every day or watch it later in the day. We try to provide you with the most up-to-date information to keep yourselves and your families safe and to have some kind of a connection as we deal with the coronavirus. As you can see from the data that's on your screen or will shortly be on your screen, we are still seeing an increase day over day in the number of cases, the number of deaths, unfortunately, and the number of hospitalizations. So we're still ascending towards the peak, which we think will happen, last week of April, first week of May, approximately. But the very good news is that due to all of your hard work and sacrifice, we aren't seeing the steepness of the curve that we had been seeing a week or two ago. And so that just goes to show that all of your sacrifice, the mask wearing, the staying at home is working, is saving lives, and is getting us that much closer to a place where we can return to some semblance of normalcy. So I want to thank you for that. I also want to give you a reminder on your contact tracing notebook. I will be very honest. Yesterday I realized that I had gone a couple of days without jotting into my contact tracing notebook, my contacts, so it was a little wake-up call for myself, and I figured maybe you could use a reminder yourselves. We are at a place now where we're testing over 2,000 people a day, pretty much the highest rate in America of any state. And if you are tested positive, you will immediately be contacted, or very soon thereafter, by the Department of Health, and they will ask you for all of the names of the people you've been in contact with in the past days. And at that time, I need you to pull out your contact tracing notebook so we can have an accurate accounting of who you've been in touch with. So it takes a daily discipline and vigilance. As I said, I forgot, so I had to go back and try to remember and fill in the blanks. So this is my reminder to each of you. Please, every day, take a second or two, jot down where you've been and who you've been in contact with. And remember, the goal right now is to be in contact with the same few people every day. That's the single most important thing we can do to limit the spread of the disease. Probably like many of you, I woke up today a little bit shocked and a little sad to see snow. It's supposed to be spring and it's snowing, so I want you to know on your behalf, I called Mother Nature and told her to knock it off and send us some warm, sunny weather because we need to get outside and start our gardening and go for a walk around the block. Okay, a few announcements. Some good news. I'd like to begin with some good news. On account of the very hard work of our federal delegation, you know that a few weeks ago, Congress passed a $2 trillion federal stimulus package. $1.25 billion of that is coming to the state of Rhode Island to help us deal with our COVID-related expenses. And the good news is that yesterday, half of that, $625 million, landed in the state's bank account. That is a welcome relief. It is much needed. Obviously, like many of you, your income is drying up. Our revenue has dried up precipitously, and also we're spending money to deal with the crisis. So I want you to have some hope and confidence to know that we've received $625 million from the federal government. The remainder of that will be coming in the next couple of weeks, and we need it, and we'll put it to good use. We're still waiting for the Treasury Secretary, Secretary Mnuchin, to provide us with the guidelines and regulations around how we can spend that money, but we know it's for COVID-related expenses, and it is certainly a relief to have it in the state's, on the state's balance sheet. I want to take a second to sincerely thank our federal delegation for the part that they played in making this happen for Rhode Island. Senators Reid and Whitehouse have been in great contact with me the entire time and have been quite literally fighting for Rhode Island in the United States Senate. The same is true for Congressman Langevin and Congressman Cicilline. Both have been in regular contact with my office, asking how they can help, what they can do. All four have been outstanding servants to the people of Rhode Island, and so I want to thank you guys for your work and let you know that I take comfort in knowing that the four of you are in Washington fighting for us, and we are all grateful for the $1.25 billion and the role you played in advocating for the advance of half of that to arrive in our bank account. You've been outstanding, and to each and every one of you, thank you. Special thanks to Senator Reid, the most senior member of the delegation, who's quite literally in the room with Secretary Mnuchin, crafting this and making sure Rhode Island gets its fair share of the stimulus. So thank you all. It's been, on a personal level, a pleasure for me to deal with each of you. You've been fantastic partners and friends to me, and I want to thank you for that. Earlier this week, I signed an executive order issuing clear direction about face coverings. I signed the executive order on Tuesday and announced at that time it would become effective today on Saturday. My thinking was that it's a change for businesses, a change for all of us, and I wanted to give everyone a few days to get yourselves organized and in a position to be able to provide employees with masks and for employees to get used to it. So it's effective today in the state of Rhode Island is an executive order as follows. All employees of customer-facing businesses, office-based businesses, manufacturers, nonprofits, and construction workers, that's essentially everyone who is going to work in an office, must wear cloth face coverings the entire time that they are at work. Additionally, all customer-facing businesses must take steps to remind their customers to wear face coverings. It doesn't mean you can turn customers away, but I want you to do everything you can as customers are coming in, verbally and with signage, to remind all your customers that they must be wearing a face cloth covering that covers their nose and their mouth at the time that they come into your establishment. The only exceptions for this are anyone whose health would be in jeopardy because of wearing the face covering or children under 2 years old. And frankly, if your health would be in jeopardy for wearing a face covering, you should not be leaving your home. And if you need a hand getting groceries or getting out and about, get in touch with us and we can help you do that. This is weird. There's no other way to say it. I've heard from a lot of you saying, do I really have to do this? Does it really make a difference? It feels strange. It's hard to breathe. The answer is yes. Don't look for ways to get around the rules. Look for creative ways to follow the rules. Wearing a cloth face mask will not prevent you from getting the virus if you are in close proximity to somebody who has it. It will, however, go a long way in preventing you from spreading the disease to somebody near you. So basically, I'm asking each of you, all of us, to sacrifice to help out the rest of Rhode Island. That's what this is about. This is about each of us being put out and inconvenienced in order to help everybody else. And it will limit the spread of the disease. That's a fact. So I'm asking you to get creative, figure out the best way that you can comply. But as of today, it is official that this is what I'm requiring businesses to do and everyone to do when they are shopping, and if you're an employee who has to go into work. DBR, Department of Business Regulation, will be doing random spot checks of businesses starting today to make sure that there is compliance, and they have my authority to go ahead and issue additional regulations, including fines and other enforcement mechanisms, if we feel that businesses and individuals aren't complying. So let's do it. Let's just do it. It's not fun. It's not easy. It's not what any of us wants to do, but we know it'll work, so let's make it happen, and let's keep Rhode Islanders safe and healthy. I want to take a second to address the art community, the arts community. I would say that there's so many folks struggling right now, and I am trying to be mindful myself of those who are the most vulnerable. And I am fully aware that nothing we are doing is perfect or is really enough. Like, we're trying our best. Every day we get better. We're trying to do more and better testing in inner cities. We're working like crazy in nursing homes. We're trying to reach out to people who are struggling with mental illness and addiction. Like, we're trying, the homeless. And we are conscious. We're conscious that we can't get to everyone, but we're conscious that there are certain groups out there struggling a bit more than the rest of us. And one of those groups is artists, and I'd like to take a second to draw a bit of attention to that. I will say that Rhode Island's art and culture scene is a real point of pride for us. We punch far above our weight when it comes to the level and quality and number of artists that we have in our state, and it's part of what makes our state vibrant and fabulous and edgy and really a cultural center. But the reality is, right now, our galleries and studios and stages are dark. So if you're trying to make a living as an artist, it's incredibly hard, if not impossible, and it's another part of the terrible reality that we are dealing with. Thankfully, we have expanded unemployment insurance benefits, and I would encourage every one of you to apply. You're eligible now if you're self-employed, even though you typically aren't, so please go ahead and apply. But I also want to draw attention to a relief fund that's been established. It's called the Rhode Island Artist Relief Fund, and it awards grants of up to $1,000 to help artists, art teachers, arts administrators, and other freelance arts and culture workers to get through these tough times. The fund was launched recently by the Rhode Island State Council of the Arts. Thank you to Randy and all of you, in partnership with the Rhode Island Foundation. Thank you again, Neil, for being so fantastic through this, and Providence's Mayor Jorge Elorza and the city's Department of Art, Culture, and Tourism. I also would like to thank the Alliance of Artist Communities, which is a national organization that'll be managing and maintaining the fund. After only 2 weeks, the fund has moved quickly to disperse about $126,000 to help about 250 artists throughout the state. On an individual basis, we know the needs out there are clearly much, much greater, and $1,000 is, I realize, a drop in the bucket, but it's something. It's something, and I hope you'll take advantage of it, and I'm deeply grateful for all of the entities that came together to find that solution. I will say, if you are one of the fortunate Rhode Islanders out there who is still working and in a position to make a donation of any size, I'd ask you to please do that. Make a donation to this fund. You can go to artistcommunities.org and search the Rhode Island Artist Relief Fund and make a donation. And if you're a local artist in need of support, and you're hearing me say this, go to the Rhode Island State Council on the Arts website and you can figure out how to file an application. Every little bit helps, and as I say, the artists in our community are part of what make this place special. So please give if you can, and don't be shy about reaching out for help if you need it. Although there is snow on the ground today, it is still spring, and I think tomorrow is going to be beautiful, which means we are hearing from many of our local smaller garden centers who usually reopen at this time of year, and they are inquiring as to whether they're allowed to open their garden centers now that spring is upon us. So I've heard you, I'm hearing you, and I want you to know that I've directed DBR, Department of Business Regulation, to work with DEM to address this issue and figure out a safe way for you all to open your businesses. By Monday, we'll be issuing guidelines that will enable garden centers in Rhode Island to open by April 27th, but with restrictions designed to keep everybody safe. I want to thank DEM, Janet Coit. It's fantastic. She's been leading this and in touch with the owners of garden centers. And I want to thank the garden centers for reaching out to us. You did exactly the right thing. You want to open, you should be able to open, and you want to work collaboratively to do it in a way that reduces crowds and enables us to have appropriate social distancing. So on Monday, we're going to issue some guidelines that'll tell you how you can reopen by April 27th. In the meantime, starting tomorrow, Sunday, I'm requiring big box stores that have garden centers to close their open browsing and shopping options within their garden centers. And I'm requiring them to restrict their garden centers' sales to pickup, delivery, and appointment options. We've unfortunately continued to hear way too many instances of crowded garden centers and people just too cramped and too close to one another. So we want you to be able to go buy your garden supplies, and big box retailers can still sell, but it must be done appointment only, pickup, delivery, or curbside pickup. And I hope by April 27th, you can all be opening for business under a new set of regulations. That mention of garden centers is a good segue into what we will be talking a lot about next week, which is reopening our economy. In getting us to this point, I have taken a fact-based, targeted approach to how we've done things. That's how we've closed our economy. It's been incremental, changing when we need to, being flexible, responding to the facts on the ground. And that's how we will reopen our economy. Thoughtfully, in a pinpointed way, incrementally, with guidelines by industry. I have asked Commerce Secretary Stephen Pryor to lead this work. He's already been spending weeks on it, planning, working with me and our other teams, talking endlessly to members of the business community. Our goal is to reopen as soon as possible, as is safe, with new restrictions, industry by industry, in phases. And we're going to have a lot more to say about that every day next week. Our approach in doing this I want you to know, is going to be very inclusive. We're going to be, as we have been, in very close contact with chambers of commerce, larger businesses, the Rhode Island Partnership, which is a collection of the state's largest companies, small business associations, the Hospitality Association, the Manufacturers Association, labor unions, public sector and private sector, making sure we're reaching all communities, Black Business Association, Hispanic Chamber of Commerce, getting into the smallest businesses. Rhode Island has a very high percentage of Rhode Island's economy is in small businesses. Unfortunately, that has been who's been hit the hardest in this, is the smallest businesses. So we also have to be very thoughtful. It's not just about reopening our big companies and our biggest manufacturers, although we want to do that. It's about being very attentive to the needs of our smallest businesses as well. So I'm saying that, first of all, to say thank you. You've been incredible. Hospitality Association, Manufacturers Association, Chambers of Commerce, some of our big employers, small employers. You've been phenomenal partners. We've been in close touch with you. But we also need you to stay very, very engaged, because we can't develop these guidelines in a vacuum. We'll be developing the guidelines in consultation with other states and business associations and the federal administration, running them by you for your feedback before I go ahead and promulgate anything. So that's by way of telling you what's to come, thanking you for the work you've already done, letting Rhode Island know it'll be a very inclusive approach, and previewing for you, where I expect to be guiding us over the weeks and months to come. So with that, I'm going to turn it over to Dr. Nicole Alexander-Scott, and then we'll open it up for questions.
Thank you, Governor. Good afternoon, everyone. As was posted on the data dashboard on the Rhode Island Department of Health's website earlier, we have 317 new cases. That brings our case total to 4,491 for COVID-19 in Rhode Island. Unfortunately, we also have a number of fatalities to report today. Our number previously was 118, and with 19 additional fatalities we're confirming today, we now have 137 total fatalities. One person was in their 30s, 2 in their 50s, 3 people were in their 60s, 4 were in their 70s, 7 were in their 80s, and 2 people were in their 90s. 10 of these people lived in congregate care settings. 17 of these fatalities occurred within the last 24 plus hours that we report this out, and 2 of them had occurred the day before. Our hearts and condolences continue to go out to the families and the staff persons and extended family members involved with these situations. Yesterday, I detailed the many ways in which we are looking to face the very difficult challenges at our nursing homes and in our congregate settings. I spoke about all of the efforts that are currently ongoing and talked about what we are looking to develop and continue to advance going forward. The Governor and I want you to know that we remain committed to keeping residents in these and other congregate settings safe while supporting nursing homes and other congregate settings staff and leadership. We are also committed to continuing to address the needs of communities throughout Rhode Island, in addition to those within congregate settings. We have, for example, an outreach plan in place, action steps that are being taken to help address the concerns that we acknowledge are occurring with communities of color in terms of the data. I can share a note about the outreach that is ongoing. While 45% of cases of COVID-19 happen to be among the Latino population from the numbers that we have sampled, we may have some of these numbers as a result of the outreach efforts being made, and we know that we need to continue to advance the outreach and the response and making sure that all communities have the support they need with the access to testing and the services needed as well. We have made sure that our materials on testing and other services are available in Spanish. We want to continue to improve that and ultimately begin to expand to other languages. We regularly have colleagues call into our Spanish radio stations to give updates on COVID-19 and the need for testing. We want to continue to do that more and engage all of our racial and ethnic radio stations and media outlines to be able to communicate actively with the communities that we need to. And we've also made sure that the public knows and want to continue to reiterate the importance that everyone knows that there are no barriers to getting a test setting site set up throughout the state, and to make sure that no one worries about immigration issues at any of our testing sites. We have an expansive list of locations throughout the communities that's been informed by community leaders, informed by our health equity zones initiatives and partners, and informed by residents of communities, so that we can make sure accessible testing is set up in areas throughout communities involved, where people can walk to get tested or go to local areas where they are used to being able to get the information and resources that they need, so that access to testing can be available from that standpoint. We welcome the opportunity to continue to expand that, and that's where I'm referencing that there aren't any barriers to setting up testing sites to address that. Another bit of feedback we're getting from people's calls and emails is about wearing facial mask coverings. Wearing a cloth face covering or a face mask in a public setting does not negate the need to keep social distancing standards in place. Just because you have a face cloth covering or a face mask in place in a public setting, it still means you absolutely need to abide by the social distancing requirements that we have said. That's standing at least 6 feet apart or more. We've been hearing reports from some Rhode Islanders who are concerned that while grocery shopping, for example, where they are respecting the 6-foot distancing standard, someone else comes close to them and reaches in to grab an item on the shelf. To be clear, our guidance on social distancing has not changed with the addition of wearing a face cloth covering. Wearing any kind of covering over your nose and mouth does not make you invincible to the coronavirus. We must continue to do both, wearing a face cloth covering as well as respecting the social distancing boundaries that are in place for a reason. I'll finish with saying that yesterday Governor Raimondo spoke movingly about bravery, about how we're all going to have to be brave in small ways and in big ways. Today I'll pick up on the governor's theme for a moment and talk a bit about how we can all be brave. In doing so, how we can become a more resilient community together. Looking after our families and looking out for our neighbors are acts of bravery, and they're at the heart of community resilience. We want to help make sure that every community from every zip code has the resources and the support they need, and that you have the empowerment, the courage, the bravery to be able to look out for your neighbors, be able to advocate for others, be able to reach out to the seniors or those with differing abilities who are not able to get out and get access to the food that they need, to pick up the phone and call someone and reach out. Let's make sure that we ourselves are doing the things even if we don't want to do them, because that is what being brave is and makes our community stronger as well. Quarantining, staying close to home, going for a walk or a run in our neighborhood versus driving to a state park to exercise, these are the practices that are selfless and brave and help make Rhode Island a more resilient place that's better able to blunt the impact of COVID-19. Being optimistic despite grim statistics, despite grim weather, that's brave. Being able to support each other, being tenacious, continuing to push forward. It's the harsh reality that we have with the cases that are in place, but we want to continue to encourage the bravery that's there as well. Continue to document your contacts, continue to stay at home, continue to call and reach out to the neighbors and the colleagues that you have. In a pandemic, more than ever, the actions we take to support and protect each other can and will reverberate broadly throughout our community. That's what's going to help us get through this together. So let's continue on, and I will stop there and get us started with questions. Thank you.
Sure. Our first question is from Tony Mendez of Poder 102 FM. What is your team's action plan to improve Latinos' chances against COVID-19, given that almost 50% of the positive cases in Rhode Island are Latinos?
A lot of work needs to be done with this. We have a team that's focused within our testing work stream on being able to set up testing sites throughout our communities with the particular focus on our Latino communities and other racial and ethnic communities of color. We have testing sites that will be rolled out, as I mentioned, accessible for people who can walk to them and be able to access them more easily than some of the additional sites that were originally started. And many of the outreach efforts that I discussed earlier. We want to make sure we're engaging with our faith-based communities. We want to continue to leverage our health equity zones, infrastructure, and the tremendous amount of work that's being done through Rose Jones and the team that the governor had shared previously in helping to make sure that access to food is present, access to other social services, and we want to continue to carry on the conversation so that we can respond. Many of us have talked about the fact that it is addressing the conditions that people are living in, housing, education, transportation access, access to fresh fruits and vegetables. When we have those better established, those structures in place across the board, regardless of the zip code, then we will start to see improvements in the types of numbers and the disparities that we're seeing with COVID and many other diseases and entities. So this is going to continue to be a partnership, and we stand ready to engage and respond to what we absolutely should be doing to make sure that our Latino population, as well as others, have what they need to get through this as well.
Thank you. I will just add that obviously this is something that's very concerning and we are very focused on. We're trying to figure it out. We're trying to figure out why and what we can do to improve the results. In fact, we'll be spending a good bit of time this weekend really trying to understand it. I will say to members of the Latino community and everybody, please obey the social distancing guidelines. And that even means within your families. So it's very important, as we've been saying, 6 feet apart, no more than 5 people together, no big group gatherings, no gathering in churches. It's difficult, but we know that it works and it will prevent more people from getting sick. So we'll have more to say about this in the coming days as we try to unpack it and figure out what more we can do. And in the meantime, my message to the community is really hunker down and take the stay-at-home order seriously to protect yourselves and your families.
Kathy Gregg from the Providence Journal is next. She notes that on Thursday, the state closed a single DHS office with 100 employees and placed 60 on quarantine because of a single COVID case. She asks, when do you close other state offices, order those workers who who can to work from home and furlough the rest to save money and protect the workers?
We have what are called continuity of operations plans, COOPS plans, which we actually worked on for years. And so the Rhode Island Department of Emergency Management makes all the directors submit their plans, revise them regularly. This is part of what Rhode Island does to be prepared in general to all kinds of crises. When the COVID-19 crisis outbreak happened, we revised and updated all of our continuity of operations plans, and so we have office closure plans in place for all state facilities so that we're prepared when an instance like this happened up at the DHS office in Pawtucket. The nature of that office and in the employee necessitated that we send everyone else home in an abundance of caution and frankly to protect our employees while the Department of Health does their contact tracing program. But we have been working closely with them and felt well prepared to be able to pull the trigger on that plan. We have been working aggressively on telework to get more state employees working from home. We have over 2,000 employees who now have telework plans in place. Since the crisis started, we've deployed almost 700 new devices in order to enable people to work from home. We even have people doing virtual call center responsibilities from home so that they can help process things like unemployment claims and DHS payments, all from the safety of their home. And so we have been rapidly expanding the technology deployment in order to enable state workers to stay protective and stay safe. And then the final piece, the furlough question, which has come up many, many times. And the answer is the same, which is that that's the last thing that we want to do, although we do need to be clear that the condition of the state budget is extraordinarily difficult. State revenues have fallen dramatically, and we've got some really tough choices ahead. And so for now, as we can continue to get cooperation and flexibility from our workforce, where they're willing to go help out in other places where the need is the most, to be able to meet Rhode Islanders' needs at some of their most vulnerable moments, then we'll be able to keep all of our employees productive, and push off the conversation about furloughs, because that's not what we want to do, and we hope it's something we don't have to do.
Thank you.
Thank you, Brett. That was excellent. I do want to underscore that point about furloughs. Furloughs aren't off the table. The revenue, as Director Smiley said, is, like in every state, really depressed right now. And our casino has been closed for over a month, third largest source of revenue. So it is my strong goal and direction and guidance to avoid furloughs. But at this point, I can't rule anything out. Nothing's off the table. And as Brett said, our ability to avoid furloughs depends upon our workforce continuing to be flexible and understanding as they have been. And it's our hope that we'll work collaboratively with them in order to keep everybody employed as long as possible. Because the last thing I want to do is to contribute to the state's unemployment rate and to put out of work any state employees who, many of whom have borne a difficult burden as we've dealt with this. So I would say I hope to be able to avoid it, and I'd ask for continued cooperation from state employees and state employee labor unions to work with us in partnership so that we can avoid furloughs.
Brian Amaral of the Providence Journal asks, in regard to the model you released the other day, the projections you've released show the peak for hospital beds. Do you have projections for ventilators? How many will we need at peak, and will we have enough?
I do, Brian. I don't have them at my fingertips, and I don't want to say something wrong, so I will get back to you by the end of the day today. We don't now have enough, to be very honest, but we have a number more on order. And as I've said all along, it is my goal to work for the best and hope that we're not going to see the peaks that I have revealed in the models. And at this point in time, we certainly have enough. We just received 100 from the federal government. We continue to order. So there's absolutely no reason for alarm, but we're still procuring so that if we get up to one of those peaks, we'll be ready when we get there.
Tara Granahan of WPRO Radio says that we've been told distance learning is going well, but a Providence district administrator says statewide 40% are learning, 40% are trying, and 20% are not logging in at all. Your response?
So that is not consistent with the data. The number of folks who are attending is actually much, much higher than the 80% that would suggest. I'll be the first to say, though, it is not perfect, and it is hard to execute. Rhode Island is doing a better job by any metric than any state in America, and teachers are bending over backwards to be creative. We have gotten to a place where nearly everybody has access to a computer and Wi-Fi so they can work at home. And by the way, it's not just all logging on. It's not all on a computer screen. A lot of it is interactions in another way, picking up packets, doing work, talking to teachers on the phone. So I know that it's better than 80%. It isn't perfect, and frankly, it is getting better, not worse, the longer we do it. So nobody wants to be here. I would love to open the schools on Monday, but we can't, and I think we're muscling through the best we can. And for every bad story, and there are some, and it's imperfect, there are many, many, many good stories of children continuing to learn and actually learning new skills as they go through this experience of distance learning.
Christian Winthrop from Newport Buzz says in the last few days he's heard from many brides seeking guidance for their Newport weddings this summer. When can they expect a definitive set of guidelines regarding capacity limits and new social distancing rules? Essentially, they just want to know if they have to cancel.
Yeah, I just need a little more time on that. I can tell you, if you were planning a very large wedding, it's hard for me to see how that could happen this summer. In the coming weeks, as I said, between now and May 8th, I'll be making many more announcements as it relates to the regulations we'll have by industry, and that will include regulations around the size of crowds, and I'll be in a better position then to give you the details of where I think we might be this summer.
Our next question is from Alan Gerberti of 990 WBOB. Minority communities are affected disproportionately by COVID-19. There are concerns initiatives such as Roadmap Rhode Island will make these outbreaks for people of color more severe and deadly. How will you address this going forward?
Yeah. So I think we talked about that earlier. We are ramping up our efforts right now, first of all, to understand why this is happening. Second of all, we're making a very big push around more testing in communities of color and cities, and essentially we want to bring the testing to where people are so they can walk to the testing. We're also making a bigger effort around mobile testing and working hand in glove with community health organizations to make sure that we are meeting the needs of everybody, and as Dr. Nicole said, making sure nobody in any zip code or of any color or socioeconomic status is left behind. But we're still learning about the disease, and by the way, I should say we're in constant contact with leaders in the community to try to understand it better, because when we can understand it better, we can react to it better.
Abigail Nilsson of the Anchor newspaper says, yesterday you mentioned that college dorms are being considered as a place to quarantine healthcare workers. When would you hope to open the dorms for this? What does it mean for the students living in dorms currently, students who plan to live in the dorms in the fall, and also the return to in-person classes?
Okay, so there's a lot there. If you're living in a dorm, we obviously will not displace you, so you need not worry about that. I would love to be able to have an announcement next week around whether we can make dorms available as a free living arrangement. With respect to whether colleges resume classes in the fall, that's very much an open question right now. I have been in contact with the presidents of certainly of URI, RIC, and CCRI, but also with some of our private colleges and universities. They're all trying to figure it out right now. Can they open in the fall? If so, can students come back into the dorms? Under what set of conditions? Should they push back the fall start into a time that's later? So I don't think anyone is ready to make any of those announcements, and thankfully, September is many months away. But I can tell you the wheels are turning every day, trying to figure out can we let the students come back? If so, under what conditions?
The next question is from NBC 10 News Director Scott Isaacs. It's been about 3 weeks since concern emerged over people coming to summer homes from New York City. Have your restrictions worked out as you hoped? Are there stats on out-of-staters in Rhode Island who have tested positive? Do they count as Rhode Island cases or New York cases?
Yeah, so there are statistics. I don't have them off the top of my head. If you're tested here as a positive and living here, it counts as a Rhode Island case. So when you see the numbers on the screen, they are included in that. I will say for the most part, yes, it has been very effective, and people have been very cooperative. And for the people that we've interacted with, or National Guard or state police has interacted with, by and large, people understand that it's not about preventing people from using their second homes. It's about knowing who is here, helping them to quarantine if they need it, and knowing if they're positive so we can do the contact tracing on them just as we would anybody else.
Amanda Milkovits from the Boston Globe asks, what level of testing does Rhode Island need in order to begin reopening?
Yeah, it's a fantastic question, and one that we're trying to figure out right now, and that we will be spending a lot of time on over the next couple of weeks. We know we're doing about 2,000 a day now. We know it will be many more than that. I've also been in touch with many employers, and they are wanting to make sure that their employees can all be tested before they return to work. So I need to figure out a way to ramp up our testing to meet that demand. So I need a couple of weeks on that one. The answer is, multiples of what we're doing today, but I don't know precisely what I don't know exactly what that number is right now.
Our last question today is from Kelly Johnston of ABC 6 News. Will your plan to reopen the Rhode Island economy reflect the guidance announced by the president this week?
Yes, it will. So the guidance put out by the White House was high level. It was high level guidance, not very detailed, but it did say that governors should look to reopen the economy in stages, and that is certainly guidance that we will follow. So the guidance is that you can't think about reopening the economy until you've seen at least 14 days in a row of declining cases, and we know the clock hasn't started there yet because we're still increasing. And then that triggers phase one, kind of a limited reopening with fairly stringent restrictions and social distancing requirements. And then you hit another set of benchmarks, and you can go to phase two, which is a broader reopening. And so, yes, the short answer is we will be taking an approach like that in stages, incrementally. Each governor is going to necessarily have to go into a lot more detail by industry. And, of course, we have other decisions around schools and childcare, not just businesses. But overall, I think the guidance was helpful, and we'll look to comply with it. Thank you. Have a good day.